Hello, everybody.
Okay.
This is episode 89 of our podcast, Artificial Intelligence and Cybersurgery. My name is Dr. Andrew Gums. I'm here with my co-host, Dr. Vincent Grasso. We're the official journal of artificial intelligence surgery, the first journal dedicated exclusively to artificial intelligence and surgery. And so I'll let Vincent introduce our next guest.
Thank you, Andrew. Yeah, this is exciting. We're getting close to 90, the magic 90 number.
Yeah.
And it's a great pleasure. And thank you, Fatima, for your time on a Saturday to speak with us. You have a very impressive background, physician. You've trained at Oxford. You've done some work at MIT School of Management, the Sloan School. And you have a company that I'm sure you'd like to talk about. You're the founder and CEO of something. It looks like you just started recently. CLINETHIX. So if you can give our audience a little background about yourself and what you're doing in AI and technology and healthcare, it's our pleasure, and welcome to the podcast.
Thank you. Thank you for having me in your podcast today. And I'm happy to exchange with you face to face.
Yeah, yes, Fatima, please. This is always where I interrupt my first guest, and I like to jump right in. Because I like you to start where you're from. It helps me understand somebody when I understand where they're born, where they grew up, where they did their training, and so hence I'll stop interrupting you now.
Yes, of course. So I'm Moroccan native, yeah, from Casablanca, and I think at 19 I moved to France, to Paris for my studies. Medical studies, and then I follow like the classic path, finishing my studies, starting working, and that's all.
And so, what studies did you do?
I'm a dental surgeon, so I'm a DDS. I started by that, so then I pursued a credential with the Harvard Business School in Leadership and Business.
Okay.
And then Oxford and MIT with 2 programs in AI.
Nice. Excellent. And so we met on LinkedIn, I believe.
Yes.
Yes. So I would love to hear a little bit more about your company and kind of, and we'll figure out how AI sounds like grew your company or was the seed for your company.
Yes, CLINETHIX is a company that I imagine to build product that I wish I had while practicing, while studying, and also exercising in operation and governance, because I had this chance to navigate in different layers in healthcare. Also medical legal work. So it's for me the quintessence, like we say in French, to unify all the background experiences, training, to build something that has, I hope, meaningful impact. So right now we launch Sentinel, which is documentary synthesis. The particularity is that is traceable and auditable. And educator, I have the chance to try it with a pilot for in oral dermatology with my colleague and friend Dr. Tai. And companion is I think the one who is close to me, because it unifies the clinical part, but also the governance part with all what I wish having while practicing.
So that's interesting. Vincent and I we're trained in quote unquote medical, the medical field. And one part of the body that we really ignore during medical school is the mouth. Like, it's kind of ridiculous.
Yes.
Actually. It's like it doesn't exist for some reason, which is a little bit odd. But you said something which I never heard of, but which obviously is vastly important. And I guess to some extent we study it, is oral dermatology. Of course, all the oral cancers, the lesions, the tongue lesions. what have you, but I never heard it expressed that way. So that's interesting. So you are using computer vision to analyze some of those? Vincent, sounds like you have a
Yeah,
question.
what I try to do is having like an application um, to put the student in the reality of a consultation, because we think that navigating in consultation, it's something easy, but we have to use and appeal many skills. And the big part of them is soft skills. So we are talking about how to communicate, about empathy, about active listening. So we try to put them in the real scenario to see how they will interact with the patient, and especially in oral dermatology, because we are speaking about oncology and cancers. So we have to construct our consultation, how to ask, how to answer the fear, the stress that the patient in front of you is experiencing while you are doing your consultation.
Interesting.
Very interesting.
Vincent, it sounded like you were raising your hand, or no?
I had just a little anecdote. When I did my surgical residency, we had a large surgical intensive care unit, and we also had a dental surgery residency in our system. And I was very close to the chief resident on the dental surgery side. So I started bringing in the dental surgery residents to do rounds with us in the surgical ICU, because I had patients with trauma and all sorts of problems who had really bad oral hygiene. And it just seeds the bloodstream with bacteria and whatnot. And it was canceled. They're like, oh, we're not dentists. We don't do that. When they're discharged, write a consult
So
to the
stupid. We were really trained in such a foolish way back in the day. It's like mind-boggling. The old big incision, big surgeon mentality. Like, my God, I'm so glad that changed that mentality, or it's changing.
It's a good time with Fatima,
Yeah.
to maybe resurrect that the dental component into rounds and into our, especially with critically ill patients that have they could have really bad problems in their oral cavity that's just seeding. You're doing stents. It's a mess. But
Yes,
this is an exciting topic.
Yeah. And that's one of the big problems that we are facing as a dental surgeon, because we miss this real communication and with other specialties. So sometimes we receive patients, we just do a cardiological surgery or a brain one, and the mouth is completely fragmented.
Yeah, it's unbelievable. It's unbelievable.
Yeah, and that's explain why also in taking my experience in medical legal work, this lack of communication between specialties create litigation, just because we lack this communication and the information to communicate the right and to build the right protocols that everyone can penetrate at his step, doing the right thing for the patient to avoid such litigations.
So is it more of a tool to train doctors in training, dentists in training, or is it actually to be used on the wards? What is your goal, or what stage are you at?
Oh, it's something that I can really adapt to every specialty, and even outside the health system. Because what I have to do is just to understand the vision and the idea behind the person who want to build a training, for example, and apply to the application. Because it's really not hard today to build such tool. Yeah. But we like, I think, the vision, and we think that it's very hard to build such tools, while today we can navigate easily such systems. We have to link everything.
Right. So right now, are you doing the programming? Do you have someone who does it for you? How are
No,
you?
I can do all alone.
Okay. And what platform are you using to do that?
Oh, I'm not. Yeah, of course. Today it's Claude because with Anthropic because it's the one I think today.
You trust the most.
No, it's not trust because you really don't trust any AI today.
Okay. Well,
Don't trust any.
more so than the others is what I meant, or
Yeah, but
more so than some. Let's say it that
yeah,
way.
it's more complete, especially with co-work because today you can have all your stack in your laptop and work with your file directly with co-work. So it's easy. You can connect also to GitHub, so you can navigate easily all those layers. I maintain GPT because sometimes it's more interesting
Faster.
to work with, yes,
Yeah, for easy
and to
questions.
visualize sometimes things.
Yeah.
Gemini, it depends. And Grok is faster when you have to do the real research. So because he can scan globally every website you ask him to do. So it's very interesting.
I saw something interesting today. Do you know you must know what Sci-Hub is? Do you know what it is, Vincent? Or
No, what's I?
do you guys either know? Do you know what Sky-Hub is?
No, no.
Okay, so it is a website that basically gives you access for free for scientific journals. So there's no paywall or anything. You know, whether it's illegal or not it's illegal in some countries, let's put it that way, and legal in other countries. And I just found out today it was made by like a student in Kazakhstan, I think. And so what she created now, they have access to like, my God, was it 88 million? 88 million? Oh my God, some enormous number, 88, some enormous number of articles. And now she's
Yeah.
created an AI. So you can write a complex medical question and it'll give you a response and it'll give you citations. And it's amazing to me that now people, literally anybody, has access to
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 this
to,
knowledge.
to that level of knowledge. I mean,
Yes.
it's so what do you guys think of that? Is that a good thing for society? Is that a bad thing? What are your thoughts? Vincent, I'm gonna hit you with that one first.
Well, I think these tools are very valuable to give people insight into what has been we've the dark secrets of how clinical medicine works and practice, and you had to go to your doctor and you couldn't ask anybody any questions, so you kind of were at the mercy of the medical field, in the old days. It gives people insights into their health, so long as they don't just depend completely upon the answers they get to make decisions. And I think that's part of the balance, is that we want educated patients, so that we can help them with the challenges when they walk in with 40 pages of documents about what they learned, and they want you to read through it all,
Yeah.
and explain why your idea is a better one. That becomes an impossibility in a 15-minute office setting. So that there's the challenge. But an educated customer is always a good consumer.
Yeah.
And health systems that want to ignore this reality are going to have a problem. The challenge is how do you deal with it and engage with it safely, and that's the dance that's taking place. But I think overall, it could be very helpful.
Yeah. And what about you, Fatima? What are your thoughts on that?
It could be very interesting, but I see two limitations. The first one will be regulatory, because we all know about the AI Act in Europe, what is coming for the next year. We have to trust sources, and for trusting sources, we have to make a system that is auditable and traceable. So if we don't have those factors, you can't use those sources with confidence and support in your clinical decisions.
Well, exactly. But what about patients? Is it good for patients? Doctors is a different story, but is it
No,
good for patients?
and that is the second problem,
Mm.
because we all know that right now people are influenced by AI. So if you start giving like diagnosis or even treatment without consultation with the expert professional, we will face another problems in health ecosystem, I think. So
But patients theoretically still can't get access to treatment without a doctor. So, they're just able to ask questions and to question your treatment decisions. But at the end of the day, to get chemotherapy, to get pharmaceuticals, to get surgery, to get a procedure, to get a CT scan, radiology, you still need a doctor. So we're still the gatekeeper. So
yeah,
I like the idea of an educated patient. Sometimes I've seen patients with a rare illness that they've been dealing with for 20 years,
yeah.
and they've done more research on that rare illness than I have, and I think they're a great resource. I love those patients. Of course, there's a million potential red flags, but on the surface, it's intriguing. I wonder what's going to happen.
No, I agree with you, but don't forget that today AI can answer you in confident way while it's completely wrong.
Yeah,
So you see what I mean? It's not problematic to have access to the knowledge. What
yeah,
is problematic is that we have to audit this knowledge. It's like us. We take multiple decisions every day, but at every step we have to justify why we made this diagnosis, why we did this prescription, why we give this exam instead of others. And that we AI Act is asking today is that AI using as a support, a clinical support, has to be traceable and auditable in the same way. If we ask us this accountability and responsibility, if we use AI has to have the same accountability.
yeah. No,
That's the
absolutely.
only limitation.
No, no,
Yeah, we can
absolutely.
see it as a constraint, but I think it's a huge opportunity for us to build something traceable, and we have all the tools to do this today.
Yeah.
So we don't think that it's very hard to have like an auditable system. I did it with Sentinel, so if I can do it,
So you seem very, very focused on that, which of course I agree with everything you're saying. So explain to us a little bit why, for instance, say a doctor using Claude. Like when I use Claude, for instance, I write in my profile, look, don't ever lie to me. If you're not sure, tell me you're not sure. For instance, that's my guardrail, right? Obviously, when I'm writing papers or what have you. And then when I'm doing a clinical decision, obviously, I have to read the papers, and we've done training, we have to do courses. So that's not a problem. But you're talking about something a little bit different, and for instance, me, just like you said, if I'm using Claude and I come to a conclusion reading papers on my own, and maybe I ask Claude to help synthesize something, or to like, what do you think, Claude? And even though I told Claude, don't lie to me, Claude is wrong. Now,
yes.
for instance, what can I do as a researcher to kind of find out, or to audit it? Aside from asking Claude, are you sure? Are you wrong? Finding the paper yourself. You're going for something a little bit deeper. So explain that a little bit more to our listeners.
Yeah, today we have to understand one thing about the large language models, so the LLMs that we are using every day. It can be Claude, like GPT and Gemini. We shift from deterministic answers to probabilistic answers. So before we have if, then. Now we have if, probably. So it gives you like the best answer based on what you are asking for, and maybe it will be the answer that you expect to have. That is what is AI today, the LLMs today. And you cannot use this in a case of litigation in front of a judge, because we have the best practices, we have guidelines, and we have all our gold standards. And you have to follow those best practices. So it's not just a waste of time of all these institutions and organisms to spend time building guidelines. Mm-hmm. And then we will ask Claude for answer. And we have this black box today with LLMs. So we don't know how he came to such answer.
So what I'm hoping
yes.
you're telling me is that you have a product that enables you to audit. This is
yes.
what I'm,
and that's what I did with Sentinel, because with Sentinel we have two constraints that I built as an opportunity for me and for this product. The first one is permission first. I don't scrap any guidelines without the permission of the institution issued. Right now, Sentinel has all the open sourced guidelines that we can use freely without asking for permission.
In dentistry or in all of medicine?
In all of medicine. So it's not just limited to dentistry. And I am asking some organization and organism to have their permission to access to their guidelines, to check them and use it in my products.
Because so right now you have the guidelines, but you don't have the permission to use them?
Yes. And you have to, and that's one more thing that we have. And, if you build something that you want it transparent and ethical, you have to respect the rules. Because technically I can do everything. I can scrap every website.
Like Sci-Hub.
Yes.
Like Sci-Hub.
Yes, right. Yes. But the limitation is, and it's clearly notified for some website that you can't and you don't have, and it's prohibited to use their guidelines without their permission. So if you start doing this, you are out of AI Act first.
In Europe.
So permission first, yes, in Europe. Yeah. So you have to ask for this permission to be sure that you are aligned with their vision too, and that's what Sentinel do.
Well, at the end of the day, they want their copyright so that they can maintain economic control, right, of the situation, which is understandable, but
not just it's not just about money. If you take like the WHO, they permit to use their guidelines. But they want it, and they want to be sure that you use it in the right way. Because sometimes, speaking about GPT, for example, they already scrapped guidelines.
Yeah.
But when they restructure the answer, here you can find like a part of the guidelines, but with a complement that is completely an hallucination.
Yeah.
And that is problematic.
So how does somebody use Sentinel right now? Is there a website that they go to, or is there a fee they have to pay? Explain that to everybody.
No, it's a free. I launched it in free beta version. So you have 3 requests per day. You can use it as you want. And there is a bit test where I'm asking if you have to pay, how you will pay for it. But what Sentinel do is structuring the answer, giving you the grade of the answer. If there is any divergence between guidelines, so you have to decide which one is aligned with what you are asking for. And to be traceable, you have all the link for the sources used to generate this answer.
Okay, I'm actually just looking right now at the new Sci-Hub. The AI version is called Sci-Bot.
Sci-Bot.
Almost nobody outside academia knows it exists yet. a 22-year-old graduate student built a pirate website with 88 million scientific papers. Last month, she turned it into an AI. Yeah. So it's very similar to what she's doing, kind of, but you're doing it legally. And
Yes.
and so the difference is, for instance, I use Claude, or I use Cybot or whatever it was. And if I have a problem, I don't know it. Now with yours, you keep saying it's auditable. So how does that happen now? Now I make a medical mistake. I use your product and it gave me bad advice. I'm guessing, right? And I want to know where I went wrong. What can I do to find out, or maybe the guidelines are correct, how does that work?
Yes. From my side, you can connect with me and asking for an audit trail. So I have in immuability for 10 years, so I can find your answer because all is codified
Yeah.
with a unique code, so I can identify your answer. That's the first thing. The second thing, and it will be for the premium one, is that you can generate your PDF and it's sent to your address email. So you can stock all what you are asking, the answer that you receive, with the sources. And the sources, you have the link, so you can check instantly what is the sources that are used for this answer, and if it's aligned with the answer that you have.
But now, why can't I do that with Claude right now? Why can't I say, why did you come to this answer? Give me references.
He can't give you all the sources. He will not give you like the audit trail, this code, to be sure that your answer was not modified after he gives you the answer.
Interesting.
That's the point.
Yeah.
It's traced at the moment when Sentinel gives you the answer. So it can't be changed. I can't change or because I am under Azure, Microsoft. Me and Azure, we can't change this audit trail. It's locked for 10 years.
Okay. And you're saying these other large language models do not do that?
No. That's
Okay.
why we speak about the black box with LLMs, because they can't justify how they arrive to this answer.
And that's that's great that you have this. How are you able to get access to all of the guidelines? Have you contacted all of the societies and gotten all of their guidelines?
So as I told you previously, there are many guidelines that are on open source.
Yeah.
So those I can use it.
So the majority are open source, probably.
No.
Oh, no? Interesting.
No.
Okay.
The majority, you have to ask for permission.
Yeah.
And now I am in communication, I think, with almost 40 organizations
Amazing.
to obtain their permission.
I love your product, Fatima. How can we help you? We have 8.5 minutes. Can you please tell us how we can help you? Because I mean, your product sounds very exciting.
If you have any contacts in those organizations, that will help me to access the right person and to obtain those permissions. Because that is the limitation today. The WHO was very favorable to my product. So I'm waiting for an answer because they asked me for a brief technique to understand how it works.
Yeah.
In Europe, they are more open. I see that they are more open because they are looking for something that will answer all the limitation for the upcoming AI Act. In USA, it's a little bit hard.
Yeah, definitely.
Because money, it's more important, I think. So we will see. And they don't have the same limitations and complexity too. That's I have to be fair about that because they have other consideration, and I completely understand.
So of all the guidelines, about what percentage are you able to access right now? Your best guess. Is it a quarter? Is it 50%? Is it 75%?
Now I think that I have about 10 to 20% of what I want in open source.
Yeah.
And just if the WHO and I think the Mental European Organism, I think that we can move to 40%.
Wow.
Yes, and with some in the USA and Canada, I think that we can be to 80%.
So Vincent, we don't have a lot of time left. What are your thoughts on this product? I mean, it sounds like this could be Sci AI, uh, but more legal, if you will. Or
Yes.
is the cat out of the bag already? Is Sci bot gonna what's gonna happen here in your view, Vincent?
I agree with Fatima. We have the technical prowess to take 100 million documents and do all sorts of things with it in a large language model. But without governance, without following regulations, without protecting the public, that's a technical exercise. That doesn't mean that it will move forward and be adopted. So it's kind of like a showy show. It's a showcase. Look what we can do technically. Okay,
Yeah.
but bringing it to the market's another story. So I'm in Fatima's camp. Doing things correctly with governance, with the audit trail. How did you arrive at this so that I could be, if there's a problem, where's the audit trail? Otherwise, it's my word against your word, and all that does is create ambiguity. So I'm more in Fatima's camp. Technically, we can do it, but it's got to be done the right way, and that's why this is so exciting.
So
Thank you.
Fatima, the great we don't have a lot of time left.
Yeah,
So
I
please
speak a lot.
send me. Well, I'll let you finish in a second. I'll let you finish this off. But can you give me a list of surgical societies, maybe that I'll put you in contact with whoever I can,
Yeah, with my
current
pleasure.
presidents and things like that. And yeah, we're very excited about your product. I don't know if we could. I would love for Aeons or the journal to somehow like I don't know what would it be called, Vincent, to sponsor you or to be a
Yeah, maybe
partner or
highlight focus news,
something.
white paper on or something. That'd be great.
Something we'd love to have like some kind of like informal partnership to just kind of give you extra publicity or something because what you're
Yes,
doing is
with
massively important.
yeah, that will help a lot. So thank you for your willingness to help.
Yeah.
And yeah, of course, I'm open to what could help because it's not. I don't build CLINETHIX for the hype of AI. I build it because I know that we have all the technology to do the right things, but maybe because I navigate those different layers, so I can understand. I have this overview what is happening in health ecosystem and how we can do the right things and how to adapt AI to health. We cannot adapt health to AI. It's AI to adapt to health, and that will make a huge difference. And for AI Act, for me, it's an opportunity to build something that will be really meaningful and impactful for people. We don't have to be fair about what is coming for the next year. I think that because the hype is in our back, we will see for sure real products with meaningful impact and having this, when you say, wow, that is the thing that I was looking for all this year. And as a clinician, that will shift our way of work for sure.
You know what I would love? I'm just thinking about it. I would love people to come to our website and then have the ability to click on your website. Like,
Okay.
you would be the official LLM of the journal, like if you're going to do research, use this, this is validated or, whatever we come up with. And
Yeah, and
vice versa. We would love to be, on your website, like, in partnership with this journal,
yeah, with my
something like
pleasure.
that.
I can build this. It doesn't take a lot of
Yeah.
time to have just an HTML and you are on it. And Sentinel is built also in that way. So if institutions don't want to have their guidelines out of their website, I can put Sentinel in their website.
Inside.
Yeah, so they keep their sovereignty in.
You've had a lot of experience. I can tell dealing with
Yeah.
a big institution. So we have to end. Let me just thanks everybody. We'll talk for the last minute we have on this, but great stuff. Vincent, any last words? We're good.
No, this is exciting. We need to have another discussion with Fatima.
Yeah, we do.
Thank you.
Thank you.
Thank you.